I don't care what you say about him. He's cool as the day is long. My name is Bob, by the way. We're gonna have some fun today because it's sort of our Friday. My man here has offered up his world to a video. We do a lot of videos, and sometimes we start the morning, we're like, well, what are we gonna video, right?
Yeah.
And so the most important thing is I told the girls I gotta be awake in the morning, even though they are, and we get them jacked up with coffee going really early. But Eric came in from somewhere else, right?
Yes.
Stayed at a hotel, right? That's cool. That's super cool. I mean, we appreciate that. We know what it's like to travel and all that stuff. It was interesting during the pandemic, to say the least, for a lot of our patients. And so I think we've endured the worst of that. So I think we're pretty much over that. So I was thinking about what I wanted to talk about today, and then maybe, you know, what Eric wants to talk about, or maybe something that he wants to share with other people to sort of make it interesting, maybe, or to tell you about his specific world. So Lacey, my good nurse, came in and she told me two things. She said, Eric's a sweet guy, which we love. We love people that are kind of super cool and sort of even-keeled and sort of just easy to get along. And you could tell the minute I walked in the room, he just had a big smile for me. And I always tell everybody, that's a great way to start any relationship and start the day for sure. She did say that he heard about us through Reddit, okay, and that he can actually help us a little bit. You know, I'm on Reddit, and Eric had mentioned to my nurse that I'm a little blunt on these things. And anyone who knows me, I'm blunt. I'm from Brooklyn, so I'm blunt and I'm painfully honest. And I know I tell a lot of the guys things. You know, the funny thing when you say that is there's a ton of stuff that I don't say.
Right.
Which is super interesting, and I think the guys who get to know me actually know that, because they're like, he would just say boom, but if he doesn't say anything, he's just trying to be a little bit more touchy-feely and sensitive. So the point is, when I tell you what I tell you, my friend, it's not that I meant to kind of, hurt your feelings or anything. It's just the truth. You know what I mean? It's like, I've done a lot of this, and I'm in the bowels of this, and I understand a lot of this stuff. And I know when people are new to it, you know, they think that, I'll give you an example, is that, oh, well, you're going to come in with gyno, but you're going to come up with this funny stuff, which like, well, do I have it? I mean, how many people that when you post a picture, do I have it? Is there even a question? Yeah, you got it. I mean, it's based on appearance, but I get it because you see ranges of stuff. And just because you have it doesn't mean anything in the world, really. I mean, it's just not, you don't necessarily do anything about it. And if it doesn't bother you, then certainly, leave it alone. And we know tons of people that are out there in America today, all over the world for that matter, who have florid gynecomastia, and you'd never know they had it, right?
Right.
It's they walk around and they're like, whatever. And then you have guys with little stuff, and they're just like, whoa. So there's ranges of gynecomastia and how you react to it. But when I tell you have it, it's not meant to be a slap in the face or anything, my friend. It's, you got it. And so let's get over that, right? I think weight is a big issue that some people have sensitivity to. I personally can look at a picture and decide whether or not I think a patient is over where they should be. And remember, this is not a personal thing. You can be whatever you want to be. And it's not about whether you look like a pretty boy or not. I'm just concerned about your health, and I don't care what any of you say. Being overweight is just not a good deal. I understand, particularly with my bodybuilders, that they're like, well, I'm bigger and all that stuff, and I get that too. You know, I gained some weight when I lifted weights for a year, but there's still limits with that as well, and it's just my way of saying that, bear in mind that you have to be conscious of your weight, and if I tell you that your weight is up or going in the wrong direction or whatever, dude, relax. It's coming from a physician.
Personal.
Yeah, it's not personal, man. I'm trying to help, you know. And there's other instances, well, you're not going to cure your gynecomastia without a procedure. I'm sorry, it just doesn't work. I'm actually working on treatment of early gynecomastia real early with some stuff, and I'll talk about that at some other time. But that's almost like you had a perfect chest. You've taken some substances and you develop pain and some growth, and it's like, say, a month or two after you've taken X, Y, or Z, and there's so many more people taking stuff than the old days. Remember, when I was a kid, we didn't take anything. It was like Wheaties, oatmeals, or, you know, Popeyes, you know, chicken, or McDonald's. I grew up in McDonald's, so that's what we took. But we didn't take like testosterone and bodybuilding substances and whey proteins and all that stuff. And what we do know is a lot more people are developing gynecomastia as a result of that. Anyway, enough of me. So what do you know about Reddit and how you found out about me?
Just Googling, and then Reddit was the first thing that popped up, just searching for different type of things, and then I was like, I wonder if I can do something about this, because working out has not worked. I mean, I've lost weight everywhere, pretty much, except there, like I was telling her, I got down to about 157, and I'm still there.
Still there, yeah.
So, I tried to focus on more lifting, but it's went down, but it's still, it's still there.
Lifting is trying to build up your upper chest so that it matches your lower chest and other things. So I'm learning, and I learn a lot from all you guys. But it sounds like you went the way that a lot of people have gone, which is like, it's just like, it's sort of part and parcel of what I'm telling you about your weight, for instance. And I'll just think about something personal for me. So, I'm getting older, dudes. There's just no way around it. And my birthday's coming up, so I'm getting even older. Whose birthday's not coming up when you think about it? But mine's like right around the corner. But, so I have hypertension and I have a higher cholesterol, right? So I could take all the medications that I know I should be taking, possibly, right? I'm a physician too. But I'm also saying, well, what can I do to control these issues, right? So I know that weight is a huge thing and exercise is a huge thing, right? So that's something that everybody should be controlling in their life. I mean, daily exercise is a huge deal, and certainly controlling your weight is a huge deal. So the point is that I want to make this go away so I don't have to go to the doctor, man. I mean, who wants to go to a doctor? It's like, whoa! It's the last place you want to be, right? And I get that totally. Even I get the heebie-jeebers, but it's from a different angle. It's like, man, is this guy any good? Or I should say, is this girl any good? It's like, that kind of stuff. And I know how to be my own doctor, but sometimes you got to have someone to give you a second opinion kind of thing. So everybody wants to control their stuff. And so the weight loss, the weight changes, the different exercise. I mean, the problem is it's like you try everything non-surgical, right? And you get online, you're researching all this kind of stuff. And so the moral of the story is that ultimately Reddit is supposed to be, and it is actually, I love Reddit because the guys are pretty good. What we have to resist is sort of the people that pop on there and they say some stuff that we already know the answer and you can just shut them down. Nah, I don't want to do that. You want to help, and I want to help too, but it's like hard when you have your mission and you're in your rabbit hole, and then all of a sudden I come along and say, nope. And it's almost like you want to prove me wrong or something, and it's like, dude, I'm just trying to give you good advice, and it may save you some heartache and some disappointment, but like I said, the worst thing is so it doesn't help. But that's where the brotherhood comes in, where you help other people by teaching them what you learned from what you did, right? So, for instance, he's going to go around now and he'll tell you about his surgery maybe and how he did and what it was like and all this kind of stuff and how we were in person, even though when you think about it, we are in person what you're seeing right now, all that stuff. But I think it's really a way of just kind of helping you to help yourself and make a good decision right away, which is super cool. All right, so let's take a look at my friend here and see what we got. So put your shoulders back. So first thing first is I'll always tell you about your posture. You got to get your posture right. This has to go up. If this is sad, everything crunches down, you get loose skin. I look at him and I definitely see he's got gyno. Why? I mean, he's got this stuff. I can see it. He's got stuff that's actually standing under his arm. So what's your weight now?
176.
What's your high weight? High weight in your whole life?
My whole life is like 240.
Okay, 240 and 176. That's a large delta. That's a big change. So what immediately can I tell you why I knew that just forensically looking at his body? He's got this little roll right over here, right? He's got this sort of like, he's in good shape, but he has like this residual stuff. And to me, this is telling me he was up higher at one juncture. His skin is not as elastic as it could be. What does that mean? I mean, great skin, man, it just goes, it's just like a rubber band. You stretch it, it goes back. After a while, we gain or lose weight, and just even genetically, some of us may not have as good skin. That's not the case, and we have looser skin. So he definitely has some looser skin, and he has some looser skin here. And his nipple actually is a little bit below where it needs to be. Ideally, it would be over here, right? So there are some physicians, you look at him and they'll say, oh, well, he needs to have this cut out. Like, I'm gonna grab this, I'm gonna cut this out, we're gonna put his nipple here. Well, what I clearly learned is no. I mean, in his case, and I can feel his skin, I can actually see what's going on here. His skin's gonna do really well. Well, I shouldn't say. His skin will do really well here in the office today, and I'll show you that right away. The question is, how will he do months after? And that really depends on the post-op recovery, which I'm a big fan of, and I know that all you guys have learned that Dr. C is all about post-op, because if you want a perfect chest, you got to work for it. It's just simple. I plant the garden here. I put the seeds in. I tell you what we need to do, all this kind of stuff. You got to go home and do your responsibility. Now, when I say that, it's not like it's huge stuff, right? It's not like it's overwhelming and it's, you know, you got to do this 24/7. It's just an observation, because what's the worst case? He's got a crease, okay? It's not the end of the world, all right? And anything is going to be better in some ways than this, right? But a crease is something we want to avoid, so you have to manage your recovery, make sure the skin lies back and all that kind of stuff. Wear the lipofoam correctly. I mean, I have all videos based on all that stuff. Will this go back? It does. It actually goes up. Why? Because it just does. When I remove all this stuff over here, and you got to remember, I'm going to do up under his arm a little bit, get on the side over here. He's still probably going to have a little bit of a shelf here, but it'll be a lot better than it is. He's going to look more buffed, more refined, more compact, nice muscle. And he also said, by the way, that this doesn't bring him down that much, which is a good thing, right? I mean, he's got a solid, I don't know, what do you have? Why is it that it doesn't get to you seemingly as much as other people?
Some people are more sensitive, in my opinion, like what you just said.
Yeah.
You know, some people are like, oh, Dr. Caridi did this.
Yeah, he said this or he said that, you know.
I mean, it's the truth.
Yeah. Let the truth be told, you know. I mean, it's the truth. It is what it. Well, I mean, look, it is what it is, and so it's not that I don't care, fellas. It's just that, you know, I'm trying to help, so don't kill the messenger, you know. I mean, I'm on your side. I just don't want you to be duped and by all the nonsense. So it is what it is. That's a great way to look at it. It's sort of like the results that I try to tell you. I can't make everyone perfect. We actually do make a lot of people perfect. But the point is, you know, there are going to be some issues with some patients that are going to be relatively minor and all this kind of stuff. And you got to deal with it. It's just that simple. So it's going to be perfect. It may not be perfect, but it's going to be perfectly amazing, which I tell you. Smaller cases generally are going to do. It's easier for me to predict who's going to do super well versus the people that are more prone to some issues. Generally, those are huger cases, you know, more complex things, and expectations are important. So anyway, that's where we go. Do you have any questions for me?
No, I'm just ready to get started.
Yeah, he wants to get the show on the road. It's like, okay, enough with this video. Yeah, enough with this video. All right, so my zone system is pretty accurate the way we deal with stuff here. My new paper was recently published, which is super cool. It's more about the procedure and less about the zone system. The whole idea of my publications is to make it all sort of into the system of how to treat gynecomastia consistently and reliably so we get good results. And that's what it's all about. So I'm here to help, fellas, totally. And once again, as always, a shout out to the dudes that I have seen and interacted with on the internet. Because of you, I have learned, and that's what gives me the power to help other people, which is really super cool. Anyway, so zone 1, mostly zone 2, very little up here in zone 3. He already has some collapsed skin over here, a little bit, but not terrible. So, you know, we're getting to the end of his skin, so I don't want to go nuts. And he's young and he's healthy and he's going to be great. You know, the funny thing about this little stuff that I say down here, he can't really lose much weight, and he's not going to lose this. You know, it's like it's at the end of the line. So and down over here, he just lives. It's nothing terrible, by the way, but his weight is good, and I really can't sort of get on his case for weight or anything. Like, you did really good. And the fact of the matter is, he did that before he even came, right?
Right.
Right.
If you look at the picture I sent you.
Yeah, I know, man. And you know, that's a funny point, and we were talking about this in the office the other day, is that we're booked out, unfortunately, for a long time. And, you know, on one hand, you're like, oh, well, he's busy. I mean, yeah, we're busy. I get that. But it's not fun because you get excited about having it done, and all of a sudden they say, well, yeah, we'll get you in next year. You know, it's like, whoa. I'm working on what to do with that whole concept, but I think it'll kind of get better as time goes on. But the fact of the matter is we have to recheck your whole deal, right? The nurses, we had this discussion. So when we phone you and when your time is coming up and it may be 6 or 8 months later, you'd be surprised. We have to ask me, have you gained or lost weight? Because some guys like gained a bunch of weight. And then some guys lose a bunch of weight. Because when we look at their pictures, we're like, is this the same person? Never has the gynecomastia gone away, which is the point of a lot of this, which is really fun. I never met a person in my life that has said I had gyno one day and gone the next. Right?
Right.
Never, not once, except for maybe him. In about 45 minutes, it's gone. but other than that, there's no exercise, working out, pills you could take, regimens, diet, whatever. I mean, I wish there were, because if you can do something without me, then it would be unethical and immoral for me to do what I'm doing. And since I'm still doing it, we have not found that holy grail. Anyway, enough of boring me. We're going to go in the surgery room. We'll talk a little bit more about something I wanted to talk about, which is, what was it? I forgot already. I wanted to talk about how to have a successful gynecomastia procedure. Okay, common, meaning that, so you are searching for this. It's your first time. You're doing research. I'm going to try to lay down some basic stuff on how to have a successful interaction. And it doesn't mean just to come to me or anything like that. You can go to anyone you want. That's not the point. It's just little clues to things to think about that may help direct you to find the right person to take care of you, which is the ultimate goal, right? Yeah. So one of the things we rolling here? Okay, so one of the things we can talk about that's related to everything is there was a recent FDA announcement about skin tightening modalities that some surgeons have been using, and across the spectrum, not just gynecomastia and whatever cosmetic surgery or skin tightening. I mean, skin tightening is a cool thing, right? I mean, we love it, right?
We would love it.
The problem is
if
that
it worked.
I've taught you all that it really doesn't add much to the overall equation. That skin tightening is really a manifestation of the quality of your skin that you got to begin with. And as it relates to gynecomastia, the FDA had a strong advisory that it should not be used in conjunction with this treatment here. I don't think it hurts actually, but I guess some people have been damaged. But we would all love skin tightening as a part of the regimen because we talk about loose skin, and so we want it to be tighter. But it just doesn't work that way. And for the surgeons that sort of tell you, I think that they're more or less selling you on something as opposed to being truthful. Truthful means that it's probably something you want to hear, but I mean, for instance, I don't tell you that I tighten the skin with the Vaser, even though it does a little bit, but the contribution is so negligible. It's not even worth talking about. And I wouldn't feel good telling you it works that way. Whoa.
You have to turn the whole thing off. But you'll have to, it'll also turn his thing off too.
So one of the things we wanted to focus on a little bit today anyway is...
Hold on, Dr. C. Let me get rid of this sound. It hit the suction button, and there's only one way to get rid of it.
Oh.
It's still on?
What it... No, there you go.
Okay, it's good.
Yeah. Yeah.
Technical difficulties.
Technical difficulties. Now, what's the one thing you want to talk about today, Dr.
Well,
C?
what's the one thing? Well, actually, Lacey wanted to talk to you, and Mar wants to talk, and Becca, they all want to talk because they love this stuff. But how to have a successful... Well, Heather's here. So
That's right.
Yeah, Heather's here. Well, let's just say you're new to the whole gynecomastia thing. You found out that you had it, and then all of a sudden it's like, okay, yeah, we're going to help you, give you some guideposts on how to have a successful gynecomastia treatment, right? So I think that it all starts with knowledge, right? So I think, you've decided you have gynecomastia, okay? Remember, there's a whole bunch of different classification schemes that are out there for gynecomastia. It's confusing to say the least. And personally, I've written about my zone system and how I diagnose gynecomastia. It's basically, it's pretty visual. You have to just look. You don't have to feel a particular tissue, you know, like a rubbery, firm tissue. Puffy nipples are pretty much synonymous with the definition of gynecomastia. It all starts underneath the nipple areola complex, and it kind of works out from there. So once you've decided you have it, the question then is, all right, so do some reading and do some homework. And I've written extensively about this for many years.
You're in the line.
All right. And so go to reliable sources and start to learn. And also, you know, do it with a little bit of sort of skepticism, in a sense that there's a lot of people trying to market gynecomastia and tell you stuff they really don't know much about. You have to go to reliable sources, just like any information that you may learn or care about, you know, that may have nothing to do with gynecomastia, but it has to do with things that you need to learn in life. Go to good, reliable resources and learn all about it, and that'll help you to make good decisions. So once you decide that you got it and you realize there's not much you can do about it yourself, we know that treatment is best performed with an actual surgical procedure to remove the tissue. There are really no non-surgical services like, what do they call that stuff that I had the other day? Not Vela Smooth, but cool sculpting. You know, procedures that are out there to melt fat and all that kind of stuff. Trust me on this one, folks, there's nothing, and I mean nothing, that you're going to take or do or shine light on your body or anything like that that's just going to make your gynecomastia go away. Never happens, won't happen. At best, you're wasting money. Hopefully, the worst is you get some repercussions from it that you didn't want to get to begin with, and now you got them, and so don't want to do that. So, you know, there's a market for non-surgical treatment because that's what everybody wants. Unfortunately, it doesn't work.
Can you take this?
So therefore, the next selection is a surgeon to take care of it. That surgeon does definitely sort of determine your destiny, for sure. Good surgeons should have done a lot of gynecomastia. Remember, and I tell you a lot about this, that all plastic surgeons in particular are familiar with gynecomastia, but it's sort of in their domain. But if there's anything I can help you as a person who's done almost 5,000 of these, is that it does take a while to kind of get the knack of it. You know, remember that surgeons in general are pretty egotistical, and you know, we all think we're doing the right thing, and everyone knows nothing what we know, and we're, you know, whatever. But so I dare say practice makes perfect. That's what surgery is all about. So you try to find a surgeon that sort of gets it. How many have they done? That kind of stuff. How many do they do on a regular basis? That's just helpful. If someone does a lot of them, then more than likely, if they've, you know, learned, they'll get better at it. I've taught a lot of people that all the tissue can be removed, so the concept of leaving it behind is some of it behind to get a good result is really not true. But there is an art to gynecomastia treatment, and I'm going to talk about that not on this video, but on my website and some of my blogs, because there is sort of an art to it, right? You know, and that just gets to the point where it gets nebulous in terms of experience and judging people's skin and kind of putting it all together so that you get the best result in the individual patient. So it's not a one size fits all. The actual conduct of the procedure is pretty consistent the way I do it, but it's just how much vaser do you do, how much liposuction do you do, where do you do it. So there's a lot of little things involved that really are critical to getting that nice result. So right now I'm vasering him. This tool is using energy to sort of melt, if you will,
Thank you.
this gynecomastia tissue to try to free it up. He's kind of an interesting case. It's kind of firmer here. It's kind of rubbery. Difficult to get around for sure. I don't think I'm going to be able to shrink this much with the vaser. Probably going to have to get my finger around and kind of scoop it out. It's just stuck. It's kind of, I don't know, you know.
That weight loss.
Yeah, that weight loss kind of stuff. We're always trying to, my nurse and I are always trying to think of ways to describe it, like what's going on. Right now I'm getting underneath it. All right, so it's surgeon. So how do you find out about your surgeon? I mean, I guess the things you do is go online, right? You can go to Reddit, some other forums. I think Reddit is the best, for sure. Start to get involved, start to learn. Go to the websites, I guess, right? Check out their stuff. Look at the reviews, obviously. You know, reviews are always interesting. Everyone gets a hodgepodge of reviews, but you know, you don't want someone who has all ones, obviously. And if someone has all fives, you got to be real careful too. They might have jimmied the system. And read what people write. See if it's more meaningful than the usual stuff. And then you go visit those surgeons. And I know nowadays they do a lot of online stuff, right? So that's pretty cool. So let's just say for something I've done for many years is, you know, you just consult with me online, which is, I think, cool. It gives you access to me and some of my knowledge, and you know, give you my opinion, and life goes on. Do whatever you want with it. But that's nice. I mean, I don't have to run off to the doc and spend a lot of money and wait in the office and do this kind of stuff. So you can access docs, and then find someone who you feel comfortable with. You know, if you want, visit with these surgeons, or you know, get a feeling or whatever, make a decision, and voila. So then you're on your way to treatment, which is cool. I mean, you're not going to get better until you get this thing treated. So that's why it's a kind of a momentous occasion. Be careful just running off to you know, the first surgeon you bumped into. You know, you could get lucky or you may not. You know, I like to think that, you know, I do a lot of secondary cases where, you know, people have been done before and didn't work out just quite the way they like it. So usually it's they didn't do their homework as much as they should have, you know. And this guy right now, I could feel, man, he's got some dense stuff, and I'm trying to get around it on the side here. Everything I'm doing is by feel. So anyway, you visit your surgeon. I think the first thing you're going to have to decide is, do they have the qualifications to do it, and do they have the experience, and then you know, for most of us, you don't need skin removal. The first fork in the road for gynecomastia is always, do you need skin removal or not? So for straightforward cases, and again, what's straightforward, you know, so that's the whole thing. So skin removal is a big procedure. You have scars on your chest, and it's a bigger recovery and bigger risks, all that kind of stuff. But if you need it, you know, you get it, it's good. But if you don't, you know, you don't want it, because you can't take back those scars. I always recommend that if you feel like you need skin removal, then, or if your surgeon tells you need skin removal, then you visit with several surgeons to make sure that they're sort of in compliance with the whole program. What I've learned, among many things, is that the capacity of the skin to retract is actually pretty impressive. So, you know, most people don't need skin removal. And if you do have sort of a question, or you're in that gray area, you got to be really careful. You can always have a non-skin removal approach, and if it's not to your liking, you can always have skin removed as a secondary procedure. I mean, I think everyone would rather have it all done at once, but, you know, it just keeps your options open, especially if, you know, it's a hard call to make. But I tell you that that's probably the most challenging call any surgeon would have to make, and so experience really comes into play there. Fortunately for me, a lot of patients that I do a lot of big cases without skin removal, and it's very difficult to get a perfect result. But as I always said, I can get a perfectly amazing result. And the amount of people that I had to go back and do skin removal is really low. So that means they must be happy with the result that they got. Happy enough, which is kind of cool. After that, and I just said that choosing your surgeons, number one, okay? After that, it really shifts to this whole, okay, so you have the surgery done, now what? And if there's anything I've learned, again, among many, that the post-treatment, what you do after treatment is critical to achieving a really nice result.
That's the main thing, is you have to roll it, massage it, and at the 3-week point when we tell you can, don't do it too soon, because you could stir up some fluid or something like that. But what you want to do is you want to roll and massage it the whole chest. Like you see this whole marked area is being worked on. You want to roll the entire thing, and you can use a massage gun, you can use your fingers, you can use a roller, you can use anything, but the main point is to pretty much just take all that scar tissue, all that hardness out. I tell patients sometimes you have to go longer than we tell you to. You have to massage and roll for, sometimes we say 8 weeks, sometimes it depends on the patient, until there's no hardness left. Could be 14 weeks, could be 6 months. It just all kind of depends on the patient itself. But that is it's your homework to do, your to-do thing every single day. It's not little 5-minute portions, it's at least an hour a day. You need to be massaging it.
Well, that's if you need it, obviously. The thing is, everybody heals at a different rate. And I think the point that we're trying to make is that, and I've said this for a lot of time, it's like, what I'm doing right now is very controlled and it's very predictable and all this kind of stuff. What happens when you go home is really adding a lot of the variables to the results of treatment.
It's 11:39.
So I finished the vaser on here, and what I've learned is that his skin is super thin, right? So doesn't have really good skin. We kind of knew that. That's why it's so shifty and so lax, and that's why he's got some kind of a roll down through over here. Definitely has some dense tissue over here. Yeah, he's sort of marginal for a guy that really hasn't lost. I guess he's lost a lot of weight, but how much weight? Not 100 pounds, that's for sure. But this is regular liposuction now to remove what I've treated with the vaser, which is a machine-based energy system. We're going to pull out some of the fluid, and so I can go to the next step. So the point of managing the recovery is that you got to just do the things. It's everyone's different. If there's anything I can teach you different that's from medicine and then some other sciences, is that people are people, so it's all different. So not everyone has to massage 1 hour a day for 6 or 8, 10 months. If you heal up nicely and everything just seems normal and smooth and soft and you're perfect, well, you probably don't have to work as hard as that person who is starting to develop scar tissue, or who may, let's say, develop a seroma. There are things that just can sort of prolong the recovery. I talk a lot about fluid restriction to some degree, and I talk about alcohol restriction, because there's just things you don't want to get. Hematomas happen, but they're not that common. More common in bodybuilders because they're so vascular. So in a way, hematomas are managed, but just take it easy. Keep your hands at your side, particularly for the first 3 days or so, because that's when you're going to get something.
And if you do, we will help you, and we'll take out that fluid, and
yeah, life goes on.
Life goes on.
Yeah.
You do have to massage maybe a little bit harder
Yeah.
because it can develop some scar tissue in there. Same with the seroma.
Yeah. That's the big problem with those two objects of discussion is that, seromas and hematomas lead to harder healing or just healing excess, if you will. And so you have to manage that. And some people do really well. They just don't develop much scar tissue and whatever. Some get rip-roaring scar tissue. So if you get rip-roaring scar tissue, you just have to spend whatever time is necessary, whether it's weeks or months, until it just goes away and it's nice and soft. It's just that easy. So some of the things we're talking about doesn't mean, you're going to be stuck massaging your chest every day for an hour for 6 months. No, I mean, most of the times this is pretty boring and life goes on. We're just trying to treat those outliers, those people that are not the average, okay? Long-term thing after a, let's say, seroma, hematoma issue is scarring. And so scarring takes a full year to completely, pass. So you may have to massage for that period of time, but it's unlikely. So what do I have right now? So I'm treating this area over here. I'm not telling you it's skin tightening because it's not, okay? I'm trying to create scar tissue here, which is the opposite of what I just told you. I said you don't want scar tissue. Well, I actually want the healing to kind of help this stick back, particularly where I had this roll over here. And what you can see here, this central mass is more visible. See how it ends up right here? So this is not something I can get out other than I'm gonna have to get my finger in there and I get around this thing. It's kind of stuck. And then the issue then becomes, okay, well, that's stuck. And see the poor quality skin here? See these stretch marks? Kind of bunches up the fine wrinkles. His just skin is lax. And so this is a precarious case. It's not like the best case to potentially show you anything. It's a toughie. This is a super toughie. And we're videoing it, okay? Because we do a lot of this, and I've been here before. And it's not my job just to show you the easy peasy ones, which are a lot of them. It's to really show you the more complex ones and why they're complex, so your expectations are realistic. This is, what am I worried about? Well, fine lines on him. I mean, I can make this smaller for sure. And I can make this all look great in a t-shirt. That's easy. Making someone look good in a shirt is a guarantee. That's easy peasy. Making someone look good without one? Nah. That's artwork there. And so if your endpoint of treatment is, just make me look good in a t-shirt, well, no sweat. No sweat at all. If the endpoint is, hey doc, I have loose skin and I lost a ton of weight and I want a perfect chest, woohoo, that's harder. So I have my incision at the areolar border and I'm getting my finger in and I'm spreading around here a bit, trying to separate the mass from the skin. What we know here is that the thinner the skin, the more the contraction. That we know. That's a plastic surgical principle. So if you leave stuff in here, it's not like it's helping in a lot of ways in terms of skin retraction. And so let's just say you kind of are treating this, but you're not as aggressive as you will be, and you leave some stuff. Well, then it could be better, but it may not really be where you want to be. And again, he has really lax tissue. So, it's just obvious. I get my finger out of there and I see, it's just his skin doesn't go back. Remember too that people have big areolas. Can you cool it off in this room here? The big complaint for a lot of people is puffy nipples. This maneuver I'm doing right now says it all in terms of what I'm trying to achieve. I'm leaving a thin dermal flap here, okay? Because puffy nipples is usually one of the big culprits of the gynecomastia condition. And so if you don't remove the tissue under here, you continue to have puffy nipples. I just got a consult this morning, for instance, that from the Philippines, and the kid is like, oh, I had surgery a week ago. And he shows me these pictures. And I got to tell you that as a general rule, you know, and I want to help everybody, but you can't be reaching out to me when you're in the middle of surgery with another doc and asking me how did it go or stuff. I mean, I get it on the one hand, but that just goes back to my whole discussion is you got to go to good docs from the beginning. You can't just like, hey, I think I made a mistake or something. Or, you know, his question was, you know, it doesn't look any different. And he showed me pictures, and he clearly has puffy nipples, and he clearly has, you know, masses underneath there. And his surgeon says that he thinks liposuction alone will take care of the problem. And again, I think I put that to bed a long time ago, that doesn't work. If you leave that stuff there, you haven't really taken care of the problem. So it's just, you know, they mean well, obviously, and it can be better, I guess. But if you still have puffy nipples after you've had gynecomastia treatment, I can't imagine you're going to be happy. I'm using my finger to get around this mass. They're usually generally well circumscribed masses, which just means it starts here and it radiates peripherally, and there's a beginning and an end. The blue mark that I usually have on my patients is sort of the perimeter. It's like having a yard. It's a circular yard, and you got a fence, and so I just marked the fence. And theoretically, anyway, if we're going to remove all the tissue that is gynecomastia tissue, that tissue that responded to hormones and grew to give you this female-looking breast, well, then you got to remove it. And you know, it's really funny too. The things I tell you, there's a lot of stuff we don't know. You know, a lot of stuff I don't know. Like, you know, how often does this recur? Well, no one knows. I mean, no one's really studied it. It'd be a tough thing to study. I could tell you in my own hands that I've done a lot. I've only, you know, you've heard me say this before, probably revised, I think 2 people who I think it recurred. And so that's really 0.001, so it's a non-issue. But I remove it all, as opposed to the most common cause of recurrence is it just wasn't removed to begin with. So you could imagine that I did all this liposuction, I did all this vasor, right? And if you think that I didn't need this incision, then you know, that you might change your mind when you look at this. I mean, you can see the darn stuff, and it's his gland. You know, this is all gland, and so I couldn't remove this through liposuction alone, obviously. Go ahead. All right, so. So that's the majority of the stuff. I think there's more of it up here. So, and again, he's super well demarcated, which means that, so this clump I left up over here is just what it is, a clump that I left over here. And you can see it through the skin, so you know I gotta go after it, right? It's this thing right here. And I then would say that the whole art of gynecomastia is just getting it so it's nice, right? Like I said, I may make this look easy. That's better. Okay, so what I'm seeing up here is the border of his muscle. It's right over here. A little bit of fullness right in here. Looking around. That looks pretty bare. I may have to contour this. I probably will contour this with some liposuction. Again, I've reached the limits of his skin pretty much, so I got to be really careful over here. So what I see here is a little bit of fullness through here, okay? A little bit of fullness up over here. This is the area that you'd have a depression where I'm not suturing the deeper layer to take care of that, right? After I move that mass, but I still have some fullness up over here. This is just the upper chest. And then A little bit of a depression here, a little bit high over here. And as you can see, can you give me an oblique view here? So this line here is a flexion crease from him bending over here, and I still see some fullness over here. So see right here, can you make that bigger? So I want to make sure that I treat this area through here again to create scarring that may help that stick down. It definitely will help that stick down to some degree. And you can see how everything kind of shifted north anyway already. So, and you can see how when I say you can move the skin, it's just like, yeah, you can move it. So if it's post-op and you got a crease like this, let's say, or something like that, you know, move it out, you know, shift it. So this is where the refinement comes in. Again, this takes a lot of experience. I dare say this is not something I ever was taught. I don't think I did a single case of gynecomastia in medical training. Isn't that weird? So then why do you do it? Well, because it's in our scope, you know. So that's better there. So I like that already. I still see a little bit of fullness in this region right over here. I can see his skin is real lax up here in zone 3. I think a lot of the fat here is attached to the skin, so I'm bunching my fingers in here and really just
And there's some more lax.
getting that specific fat in that area. That looks good. Coming around medially a little bit. That looks better. And then this super lax stuff back over here. This area here along the crease here, I'm gonna work through there.
1, 2, 3, 4, 5.
Just to create healing, scarring from healing. So you can almost imagine that this concept of scarring is coming in 2 modalities, the good scarring and the bad scarring. I want scarification as a process of healing to help me in certain areas, but I don't want it to get out of control and become a mass of scar tissue that you could feel as a lump. Treating way in the back here. And again, this is not a case that most surgeons should feel comfortable about, because this is just not.
It's an advanced.
Yeah, it's an advanced case. If you send him home and he doesn't do the things that he does, or he doesn't have good expectations, you know, expectations, like I said, when I'm done, I can guarantee he's gonna look good in the shirt. But if he wants this to look super good, he's gonna have to work for it. And who wouldn't want to work for it, right? It's your chest. All right, so I see a little fullness right in this region right here. I'm trying to determine it's this. But I have this underlying, because it's 2 layers here. I get this 1 layer, but then I have this upper layer here. So I'm gonna just reduce a little bit of this. Yeah, yeah. Just to smooth it a little bit. It's fat on the skin. It's typical. We want fat, no question. But we want an even layer. So you can still see that. And the fact that we're even dealing with this is just because his skin is so thin. So thin. You know, I don't know why sometimes when I video these people, it's like, why did you choose this case? I think part of it is just because, again, I'm not here to just show you the easy peasies. Those are easy peasies, you know. If you learn anything, I'm not here to tell you anything, then this is the reality of the situation. This is what I'm up against, man. And there's only so much I can do. It's more of a, sometimes you see me go at it and it's like a bull in a china shop, but now it's more china shoppy. Trying to get, oh, that looks pretty good. I like that stitch, came in nice. I'm gonna pull this other one in here. See, this is a strong flap of tissue. Okay, I've described the anatomy.
I didn't describe the anatomy. I just reported the anatomy that existed as it applies to gynecomastia and how we could use that to help us obtain nice results. Really getting all the tissue reduced and also getting that nice result without a depression or a divot or a donut or whatever, contour irregularity, depression. Okay, so that's looking better. You definitely have, you know, tissue that's on top of the muscle now, but what I do see is this fullness up over in this region here. And there's two ways I can get at that. One would be liposuction, the other is going to be direct excision. That's a vessel in there. So, you know, your doc will contour this any way he or she feels comfortable. And this really gets into the art. Up over here. Boom, boom, boom. Hello. Yeah, she's okay. He's okay. All right, that's good. All right, so that's better. You see that little tweakage there already made that better. I still think annoying fullness right here. And I think it's really the skin fat, to believe it.
Yeah, I think it's
There's really a,
there.
yeah, it's this little stuff. I know it's getting crazy, but voila, yeah, just those little bubbles there. So right now I'm pretty happy. I'd be happy with this. I mean, look, it's not going to be, you know, perfect, but it's going to be perfectly amazing. It already is, all right? So he's got his pec muscle up over here. He's got better definition. He's sitting, he's lying down, obviously, so, you know, it's cheating to some degree, but we'll sit him up later. And this is a lot better
not
over
like that.
here as well.
I mean, that's going to be his biggest challenge is that side, right?
Yeah, so, yeah, his biggest challenge is that, you know, when he stands up, for instance, think about it, this is going to kind of go down, right? So, you know, it's really important to kind of look, I mean, this is all freed up, all right? This is like a sheet. This is your bed. I made your bed under here, and your mattress is really nice. You got a good mattress. But up on top here, this sheet is a little, you know, see what I mean? And so we move this up, we get it nice and flat, then use this lipofoam, which is like this substance that kind of holds things here. You get your posture right, because if you get your posture right, this all goes up, nothing goes down. You really just concentrate on getting this whole area nice and flat. And, you know, if you got away without a skin excision and it made a nice difference, voila, here you go. And I think I'd be pretty happy here. I am happy, but just remember, I mean, look at this, the laxity of his skin here. It's extreme, and this is just not an easy case. You know, we'll see how he looks, and I showed you other patients, but I think it illustrates a lot of cool stuff. You know, here's a complete cover. There's my internal flap, my layered closure. This is going to shrink down because I removed that mass. I removed all the tissue, as you've seen. Contour these surrounding areas. There's a nice pec muscle outline over here. The concept that this skin is separate, you know, and you can actually move it for the first few days in particular. I mean, if you go 6 weeks and you got, you know, a crease over here and you haven't moved it, it's going to be really hard to move at that juncture. So you got to try to get the creases out in the first week or so, and then concentrate more on the scar tissue that'll develop here in the healing process in the weeks to follow. The other thing is that there's nothing in here, no. So if you develop something here post-op, let's say all of a sudden, you know, you got, you know, I can't take this whole specimen, but just say all of a sudden you got this, like what's this, you know, like see this thing and you're kind of squishing it, and you know, that's fluid, you know, it's fluid. And so you got to get that fluid out, because if you don't get that fluid out, then that's going to cause some hard healing. And this is not fluid, this is just an example, but nothing is here now. If something shows up, it's oftentimes fluid, all right? Early on, it's blood. After that, it's just serosanguine. It's just normal body fluid. That's why we tell you to don't drink too much and don't drink any alcohol, and just kind of monitor the situation. And this is pretty cool. All right, so I'm going to give you guys a break. I'm going to get this other side, and then we're going to pick it up after that. So you can get a smoke. As you all know, I could talk for hours on any little subject here, because why? Because we're knee deep in this stuff. And when you do 400 cases to 450 cases a year, you're kind of dealing with patients all day long. and you listen to sort of what they're going through. I can tell you that, you know, I was so lucky to have a colleague of mine, Dr. Rorick, who has always given all plastic surgeons great advice, but he's given me some personal advice as well when I email him. He's grateful to him. He's a legend. If you follow your patients long enough, you'll be humbled. And so, you know, why am I humbled? Well, I'm humbled because, you know, let's just say, you know, you keep it real. You know, you do 400 patients a year. Do you think every one of those are going to do superb? And the answer is no. And I always qualify that by saying, well, what do you mean by that? I mean, well, nobody's going to die, and certainly nobody's going to have any tragic anything. But the problem is that, you know, we refine this technique. We've gotten closer to getting something down consistently and reliably, and that's always been the goal. But then all of a sudden you'll have a patient whose expectations haven't been met for whatever reason, right? So Mar, talk a little bit in reflective, like, you know, reflecting means, you know, the take-home message as opposed to like the specifics of the nature of the stuff that my nurses have to do, which is enormous. And, you know, what I try to tell people is that, you know, we're not a practice like, I dare say, many practices where, you know, you have your thing and then, you know, we're gone and see you later and best of luck to you, you know. You know, we deal with you. If you have concerns or issues, obviously, we took care of you, so we have to take care of the post-op as well, right? And there are themes that come up all the time in terms of, you know, the phone calls that we get. What would you say that from your perspective, Mar, in terms of
The phone calls?
yeah, and the concerns, the patient issues? What are the sort of major issues?
Do I have fluid? Do I have scar tissue? Is this something that do I need to go get a steroid injection? But what we like to do, especially since these people are from out of town, case in point, like this patient, you know, we need for them to keep us updated with photos too. Give us photos, videos. We can really then tell you, hey, yeah, you got some scar tissue. Depending on where you are at in the process of the recovery, then that may lead you to a steroid injection, or it just may lead you to just continue rolling, depending on where you're at.
Or it just may be a reassurance.
Or just a reassurance.
You know, because one of the things that I want to make sure that people take home when you say that is like, we don't need to blow by blow. We can't do that. I mean, you know, we're doing way too many people. And I think it's a tribute to our education about following your result that we get better results because you're following the instructions. So it's probably not the worst thing in the world that people are concerned about whether or not this and that is going on. But really, that's something that you have to kind of learn about. I mean, not a lot of people just don't know, and they don't know about it.
Right, they don't understand.
Yeah,
they don't know.
understand,
this is our world. We live in this world. And that's what we're here to help with, trying to tell you, no, you look good, you know, would you want the tissue back in? Or would you want, you know, you definitely have to be proud of your chest.
Look, there's a lot of people, you just do them, they're off, they're fine. Even if they have a little crease or something, they just could care less and life's gone. It's a lot better than it was. There are a lot of people that sometimes will get some hard healing, in which case, so they get Mondors that gets out of control. I actually have a doctor colleague of mine that I did, and he's got some pretty significant hard healing. And, you know, he's like, whoa, what the heck, you know? And it's sort of like, it happens, it's not common, it's gonna get better, and this is what you do. So really what we try to do is, you know, when things get to the worst point of the healing process, which again is really not that common, we deal with it, and you gotta deal with it. So you have to be patient and sort of understanding, and, you know, why did this happen to me, and all this kind of stuff comes up, and it's just the myriad of sort of feelings and all this stuff. And we get that totally. But the one thing I can tell you, rest assured, which is really amazing, we've been doing this for a long time, and we follow people for a long time, and that all those people that do have hard healing, and scar tissue is the biggest element, they get better with time. There's no question.
Time is
Yeah, I mean, we saw a guy yesterday we've been dealing with for, I guess, 4 or 5 months, and it just gets better with time because the healing process calms down and things just improve in all and always. So, you know, it just behooves you to just be patient and understanding during that healing process. And, you know, we all want perfection and we all want immediate answers. And we all want solutions to our problems. But guess what? Sometimes it's just as simple as you got to give it time and you got to keep working it and be patient. And lo and behold, down the line, yeah, that's all better, and life is good. I think the other important thing we want to talk about quickly is sort of engaging the benefits of treatment. All right, so you're all getting treatment for a reason. You want to get rid of the gross appearance of gynecomastia, right? You want to get rid of that tissue. You don't want to have puffy nipples. You don't want to have a kind of a girly looking chest. You want to start your morning looking in the mirror and feeling good. You know, you want to feel masculine. You know, you want to have confidence, and that's something that will come. You have to work on it at different levels to achieve, you know, complete success, but it will come. But I also just embrace all of you to sort of take this time to leverage your results, you know. So for those who are suffering from, let's say, you know, mental health issues and let's say confidence issues or kind of body dysmorphia issues or you know, things like that, this is a great time to sort of jumpstart a new you. You know, if you're overweight, lose the weight. You know, before it was like this guy just got in the way. You didn't want to go to the gym. Well, now you can go to the gym, and man, sky's the limit. You know, so that's what I mean by leverage treatment, so that you achieve goals that are even much further than, you know, I don't have the appearance of gynecomastia anymore. Now, how about, look, I changed my lifestyle, or I'm a nicer person, or I have more confidence, or I smile more, my posture is better. I mean, I know it sounds all silly, but it really isn't. These are kind of things that all of us humans go through, and if you can achieve sort of a greatness that far supersedes what we did, then boy, oh boy, that's the way to go. And that's the Gynecomastia Brotherhood. That's where that all stems from, and help each other out with words of wisdom and encouragement, and share your experiences, because it takes one to know one, and you never know what it's like to have gynecomastia until you had it, you know what I mean? And then, so when you have it and then you didn't, it's your time to help out those that are, you know, it's like an input-output system. I mean, think about me. We do this, what, 4 times a day, 3-4 times a day, and
4 days.
it's the same time, it's the same thing over and over again. It's just new, you know, people coming into the system, and, you know, and we love it. And we love the people that sort of do well by it and turn into be better people, and what's wrong with that? You know, I mean, so there's a lot of goodness that comes out of this treatment that we don't talk about, but I encourage you all to seek that as one of the end goals of treatment, for sure. And that's what he said. We're going to clean this up, get this looking like the other side. I'll show you the masses, and we're going to pick it up and take it from there. I originally was going to send Micah out for, I was going to say a smoke, but nobody smokes anymore. It's an expression for us older guys, but go for a coffee, I guess. But as I do this side. And then I'm thinking out loud that, you know, maybe I could just take a few minutes and concentrate really on some of the medical students and some of the residents and even some of my colleagues who are so wonderful, and their questions to me and sort of things that they can pick up, and I'm so honored and grateful to help out when I can, to the best of my ability. So, in essence, you know, this is not an easy case, and when I try to think about plastic surgery in general is, you know, sometimes less is more, okay? So, you know, what does that principle mean? Well, I mean, you know, you got to be careful. You can mess things up and that kind of stuff. And as that applies to this case we're doing today specifically, and certainly gynecomastia in general, is that, you know, so you leave some stuff, right? because, you know, let's just say in his specific case, the skin is just so loose. And you're like, man, you know, I can't really take that all because then it'll just collapse. It's like taking, let's say, all the feathers out of a pillow, right? Eventually, if you take all of the feathers out, the stuffing, right? Well, you have a collapsed kind of flat pillowcase, really, right? And we don't want that. But clinically, in this case, sometimes a little bit more aggressive, or very aggressive, I guess it depends on how you look at it. I find that they just seem to do better, and that it's almost looking at it a little different, that his skin just can't support the weight of whatever tissue's in there. And if I remove it all, or as much as I think I need to remove, then that his bag, you know, his skin bag, if you will, just does better. You know, it's just able to tolerate, and you actually get a better result than leaving tissue in there, and then he still has sort of saggy breast-like features, you know, and he certainly doesn't get the end point of the muscular definition that he may be looking for and all that kind of stuff. So a principle in general is we do know that the thinner the flaps, the better in terms of contracture of the skin. Sort of like skin grafting, that, you know, full thickness, partial thickness, that kind of stuff. Did a lot of skin grafts when I was in my young days. And this is just dermis here, right? I removed all that. And, you know, this layer of subcutaneous fat here is very minimal, and I'm just removing a lot of this, you know, glandular stuff and this tissue, the gynecomastia tissue, and then dealing with whatever's left. So freed that up, and it's rolling over here, as you could see. And, you know, the easy part now is just to pull it out, I guess. You know, here she blows. And I'm actually left with the same situation I was on the other side. You know, I still have some fullness over here, and that could be air. I got a hollow here, and I got this little fullness over here. I think this fullness over here is more I just get some fatty stuff on top of the muscle that I didn't get. But this is also potentially the flap, but that's the superficial one, and there's my deep one. So I'm going to remove some of the superficial flap, just like I did on the other side, because I know I have the deeper one. And that's going to leave me with the same situation I had on this side. So I have this ridge now that's better. I worked on this side. But I do have that superficial flap here that I'm going to completely cover his muscle with some good tissue. And I can feel this sort of, again, my nurse and I had a lot of time kind of describing this. It's like that weight loss stuff. It's thicker, it's denser, it's stickier, it's
just doesn't want to come.
It behaves differently. And so I'm going to contour this up a little bit over here. That's looking better, okay. A lot better. A little high over here. So it's similar to the, I mean, I did this, I'm doing the procedure the same on both sides. So if he has symmetry, I'll probably end up doing something similar on this side, obviously. But again, there are some side-to-side differences that you have to compensate. So that's a little bit better. Still a little high right over here. Take that down a bit just to make it smoother. There's the flap that I'm going to be working with. That is not, you know, really the gynecomastia stuff. That was removed. That's better. And then I have this area here where he had that curve that I did not get at all here. So I definitely got to get down there so you could see that roll. Now, you could certainly cut this tissue out, you know, you can do that, but really what I hope to illustrate.
Then you create a scar.
Yeah, well, so big deal. You got a scar.
But if you can do it without a scar.
You're damn right. That's the question. If you can do it without a scar and bring it to an end point that's perfectly amazing, but not perfect, makes the patient happy, That's a good thing. I mean, the question is, would you rather be on the beach with some sort of irregularity that is not a scar, so it doesn't look like you had surgery, it just maybe look like you're just a little different or whatever, you know? That's the psychology here. So I'm treating down through here because that's the area where he has his roll, and I'm trying to get that to stick back. Some people go back better than others, and that's just the way it is. So when I see a patient, you know, and it's like, well, you can tell they're disappointed, but it's like, dude, you know, sometimes you take what you get and you don't throw a fit, you know, it's just that easy because you just reach the limits of what can be accomplished. And I got to tell you that we've come a long way for new plastic surgeons that are being produced today, or surgeons of any sort. When we used to do this in the old days, and I don't think I was really a part of it, you know, treatment was worse than the condition. I mean, you know, we didn't have this liposuction. We didn't have Vaser ultrasonic liposuction for darn sure. And those things have helped us to achieve just better results. Again, this hollow here and the fullness adjacent. Here it is right here. So I see this deeper flap. That's cool. But this superficial one here is still a problem. So I'm going to reduce this a bit. All right. Ooh, that was big. And it's also getting us closer to where we were on the other side. So there was pretty good symmetry. So that's just telling me I'm just working where I need to be working. That's the lateral border of the muscle there. So not much left to work with. That higher level up here that we dealt with before. Let me see. This is going to become more exaggerated when I put the stitch in. So I'll show you how that works out. This crease here, I'm going to just transition through this crease a little bit more with the lipo to create this scarring effect. I'm heading down into zone 4 a little bit over here. Feathering is a good word I would use here.
And what feathering is it's contouring the area.
Yeah, just doing some stuff.
The artwork of it.
Yeah, the art. I mean, get the finished product. I mean, anybody can say, yeah, I'm going to go in there, I'm going to remove some tissue, right? Well, to me, it's like pizza. Everyone says they do pizza, but I certainly love the pizza places that do a freaking great job over and over again. And it's the same thing. It's just more experience in terms of pizza, better ingredients. But don't get me going. All right, so Mars going up, but I want to go down because I'm right-handed. So I'm going to grab the lower flap, which is here. And then we go up to this upper flap, which is right here. You can see it, it's white, it's got stuff. Fascia. When I had written my most recent paper, when it was originally critiqued by one of my buddies, he knows me well, I'm from Brooklyn, he says, stop with your colloquialism. You know, in other words, it's like, it'd be a good read for, you know, lay people, but you know, when you go to the medical journals, you gotta write it with more terminology, I guess, you know. But I try to keep it real, you know. So I got some nice stuff there. I'm pretty happy with there. Up over here, I got this little roll of fat that's way up there. Fat and fascia. I'm gonna try to just see if I can bring that down a little bit. And it is a real fascia layer. See it right there. And this is 2 layers. I mean, it's like there's 2 layers in there, Scarpa's and Camper's fascia. And they're real, and work with them. They're gonna save you. These little flaps and this layered closure is what they made me wanna call it. These are game changers because it allows you to remove, you know, pretty much all the tissue and then reconstitute everything with normal tissue that's not gynecomastia tissue. So that looks better, for sure. Still a little bit of puffy ditty, a little bit of puff ditty right here. So I'm gonna, I tried to lipo it, it didn't really do much, so I gotta have to use my Steven scissor. Ooh, look at that, huh? Nice. So, I'm cool, I'm good. Do I want to suture that down, or do I want to remove it? I think I want to remove a little of this. Again, I would make a case that this little nitpicky blah blah that I'm doing is really the artwork. A little bit of Humpty Dumpty still, but I don't have much to work with here. That looks good. That looks good. I don't know. I mean, again, it's not a compromise, but I think this is the best that I think I can do with him under the circumstances. And like I said, I dare say most surgeons would look at him and say, oh, he needs to have his skin removed. Well, he could. I mean, there's no question about it. And we can certainly do it secondarily. But I hope to show you that I think he's going to do pretty darn well. And if we're lucky, we'll pick him up tomorrow before he goes home and get a quick peek at him. And at the very least, we'll have discussions regarding skin management and stuff like that. Real tissue that we removed. We didn't leave anything in there. The most critical tissue that we removed is the area underneath the nipple areolar complex. And that's the tissue that, unfortunately, you guys have been taught to leave so that he doesn't have depression and blah, blah. The issue of vascularity is not as big a concern. There are superficial necrosis. I've seen plenty. I've seen some skin necrosis too. It's uncommon though. And surprisingly, you need to think about it as it relates to a mastectomy in a woman. And why is it that I can seem to go hog wild here and skin does really well, but in a woman that you do a mastectomy, we're all conscious about leaving flaps and layers and all this kind of stuff. Anyway, that's just a food for thought paper you might want to think about. We're going to pick this up with his post-op, and I appreciate you guys. Thank you.
So, yeah, what do you see as being his biggest obstacle when he goes home?
Well, that's a good question. I mean, I think that the whole educational value of this particular video is that this gentleman has pretty loose skin, all right? And it's thin. He's not an ideal candidate for me, potentially, to show you this impressive result. But that's never been my mission to begin with. My mission has always been to, introduce you to reality, okay? And the reality isn't a bad reality. It's just always sort of imperfect in some way. But again, the difference is just going to be ginormous. I mean, the guy has had this tissue removed. He has saggy chest. He's got loose skin. 99% of surgeons, I'm sure, would have recommended that he had skin removal just based on a picture. It's easy. And I could have done that as well. But my experience has concluded that done, hundreds and hundreds of people just like him, and not everyone gets a perfect result, but by far, the difference is just ginormous. I mean, it's just like, okay, so the skin goes back, and, he may have a little crease here and there. So, okay, so just do we accept that, or do we even try to make it better? We're trying to make that even better. So the moral of the story is that, you have to manage your skin. That's really the key here, is to manage your skin. We don't want a hematoma, so we do our best to mitigate that. We don't want seromas, we do the best to mitigate that. And then the issue is the long-term stuff is with skin management. And so the reason why we talk a lot about this, the reason why I talk a lot about this, is because it's up to you. I'm not there, right? You're home. And so invest in your recovery, which basically means pay attention to the things that I write and do videos about. And it's no reason to get hyper excited or anything. Remember, I'm trying to cover the small percentage of patients that have some issues. Because for the rest of us, it just goes well, and it's like, I don't need you, everything's fine. I call people up after 6 or 7 months with questions about everything. They're like, dude, I'm fine. I mean, what's your problem? And I mean in a good way, but I need to hear that because, again, to be humble is to follow up people and they're disappointed or dissatisfied or something like that. Now, I'm not going to take that into some rabbit hole of dissatisfaction stuff. Some people are just dissatisfied because they are. Okay, some people have unrealistic expectations, blah, 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 okay? And I'm not saying I don't have anything to do with their dissatisfaction or anything like that, but at the end of the day, I do enough of this where the likely results are pretty predictable, and then there's this variable of just how people heal. And if you're just one of those people that doesn't heal as well as somebody else, be patient. It will work out. He has to elevate his skin, he has to get his right posture, do the things that I tell him to do, And you've given yourself the best opportunity to have the most incredible result so that you take your shirt off. Okay, it's not a shirt on. A shirt on, he's gonna look fine, right? There's no question about it. You've seen it on the table, right? So even if he has loose skin that's hanging, he won't have hanging skin. It's gonna be creases at the most. No one's gonna see that. But if you want that shirt off and you wanna be proud, well, dude, you gotta work for that, or at least pay attention, and when you have something, you manage it. So don't be the proverbial, what's that animal that sticks its head in the ground, you know? It's like, don't bury your head in the sand, you know? You pay attention. Don't hyper pay attention, meaning I feel this, I feel this. I mean, you know, when it's there, it's pretty real, it's pretty obvious, and pay attention to it, and you make it better, and it just gets better over time. What else do you want to know?
You know, like the fact that he would be a candidate for skin excision, but you're not choosing to do it, and I can see why. It's like, it's a trade-off. And so, if perfection's the goal, quote unquote, skin excision is leaving something. It's a huge trade-off.
Yeah, well, it's a huge trade-off, but it's not a bad trade-off from the right patient. Right. And so that's the real question: is that you know, I can't expect my patients to know. Although you know, look, my peeps watch so many videos and they pay such great attention to what I tell them. They actually get pretty good. They're probably better than most doctors. But I could tell you that. And again, I'm not like coming at you as that I'm the only one. I think I've said this so many times, I don't have to say it anymore. But I'm not the holy one. I mean, I just can't promise you. But I can tell you is I've done about 5,000 of these. You know, my results speak for themselves. I talk freely about things that are not perfect, whatever. But, you know, if you're lost 200 pounds and your skin's hanging down, if your nipple is down on your belly button, you need to have skin excision, go right to it, and it's no big deal, okay? But if your body's in still pretty good shape and you prefer not to have long scars across your chest, well, I think this is a good alternative. But then again, it's the ability to judge who. And I would love to tell you that that's easy or that I can, you know, make some metrics or some analysis, but it's clinical judgment. What does that mean? It's experience. To have a clinician be able to determine that, oh, you know, you're likely to need skin removal or not. That's just a big call, and I got to tell you, it takes a lot of experience to get to that point, and you're never going to be perfect. But I dare say, like I said, in my case, I don't have a lot of people that I've called this non-skin treatment, and they come back and we do skin removal. So even if it's imperfect, which it's going to be, it's perfectly amazing. I've said that a million times as well. And it's just having these realistic expectations and owning your result, right? And embracing the changes that come along with your treatment so that this rejuvenates your life on many, many levels that started getting stratospheric, you know what I mean? But is that a bad thing? No, it's actually a good thing, and we can all use a boost, particularly if we're, you know, chained down or swimming with an anchor. You know, get rid of the darn thing and then see what your potential is. And to all you folks out there that are having gynecomastia treatment or have considered it or whatever, man, I wish you the best. And I hope that it changes your life for the better. And like I said, compared to the way this was done many years ago, there's no better time to consider this treatment because it works.
You're the only person here, so that's why I left the door open. I'm getting my chair. He's doing so good, he didn't even take pain medication. Yeah. I know, I don't think it'll be that hard. You want to buy them? Oh, gosh. Okay. All right, guys, we are 24 hours post-op, lipo and excision of chest tissue, gynecomastia treatment for this patient who has offered to do this video for us. He says he had a great night. He didn't take any pain medication. Everybody's pain tolerance is different, but I do hear pretty frequently that people don't even use the pain medication, which is great. He has no hematoma. He is just perfect. It turned out great. So this is the before photo. Can you see it? Okay. You can see that his extended off laterally underneath his arms. We've cleaned that up quite a bit over here. I think you can see it from there. And his skin has actually done remarkably well. I I don't want to say concerned, but interested to see how his skin would do, and it's really done really great. So let me I'm gonna spend more time on these videos showing you guys how to adjust your skin after this surgery, because it's really important and just critical to getting your overall best result. So I'm gonna use, I gotta grab the lipofoam. Hold on just a sec. Okay, so he barely had any drainage overnight. That happens. So I'm gonna go ahead and start using this lipofoam just directly against his skin. And this stuff is really great. I've said this in other videos, but it's great for pushing out any fluid that wants to accumulate in the treated area. So you see he's got this bruising through here, and we obviously didn't, go here. But what has happened is this square was right here, and it pushes that bruising and swelling out of the treated area. So that's why this is so great. And then also this is gonna help plaster the skin back. And we're starting to show you guys how mobile the skin is in this first 24 hours. So you see, you've got those creases, and it'll get his attention, sorry. But you see it flattens out, nice. You just have to pull up on that skin. So the idea is that you pull up on that skin, flatten everything out, make sure there's no creases in the nipple, and then you go bam, like that. The pressure of this garment against that keeps the skin where I just placed it, so that when you take it off, it looks flat, it gets flat. But this is not a set it and forget it situation. This is something that you guys have to do multiple times a day. I said in one video 100 times a day, and I kind of mean it. You've always got to check on it. You don't have to take everything off to check on it, okay? So let's imagine he's all wrapped up with his garment. All he needs to do is put his hand down in here and pull up on that skin, like say every time he goes to the bathroom, or find a way to make it a habit. Find a cue in your life that says, hey, let's do that. Like go to the bathroom every time, you walk into a certain room, something like that, so that it becomes a habit for you to adjust the skin. Because if you do this skin will flatten out really nicely. And then of course we didn't have to do skin excision. And that was huge, because if we he would have a scar all the way across here. And if we can avoid that, we try to, obviously. So we are really happy with how he has done. I think he's been happy with his overall experience here in Austin.
Oh, yes.
And yeah, it's been good, right? And he's given us a lot of good feedback. And he's a big Reddit guy, like we talked about yesterday. And so we're gonna try and get Dr. Caridi on Reddit a little more, helping you guys out, answering your questions. If you would, please go follow us on Instagram at Austin Gynecomastia Center. We're trying to put more stuff out that way. And if you have any questions, please feel free to reach out. You can comment below or go to our website, www.austingynecomastiacenter.com, and you can inquire there and speak directly to Dr. Caridi. You email him, and you get that free virtual consultation, okay, if you're interested. All right, guys, thanks for watching. We'll see you next time.